Why does it seem like fluoride treatments are only offered to children at the dentist? Should we all be getting fluoride treatments? Hi, my name is Whitney and I'm a dental hygienist here to talk about fluoride treatments. And before we get started, make sure to get my free oral care guide. Click the link in the description box below or the pinned comment to join thousands who have already discovered all of the essential components for an effective oral hygiene routine. This guide is an action plan for preventing and maintaining a happier and healthier smile. I made it just for you, for it can also help you prevent cavities and strengthen your enamel. And having said that, for today's video, let's talk about fluoride treatments. Lots of people have asked me in the comments things like, are fluoride treatments just for children? Is fluoride something from the past? Fluoride treatments, yay or nay? So fluoride treatments are not something from the past. They might just look slightly different from what you remember as a kid, since we have developed better ways to administer fluoride over the years, so it's not as difficult. For instance, we used to make you swish for like 4 minutes, 5 minutes even, with a gross tasting thick fluoride liquid. Then we started doing the foam trays, which can make you feel a little uncomfortable because of how big they were. Some offices still offer the trays, but now they are made to be smaller and more comfortable than they once were. And most recently, my personal favorite is fluoride varnish, where we paint your teeth and it's super, super easy. The reason kids are offered fluoride treatments at the dentist more often than adults is because kids' teeth are still developing. And when they are still developing, they are more vulnerable to tooth decay. The pulp, the nerve, the live tissue inside of a kid's tooth is very large as compared to an adult's tooth. So once a cavity starts forming, it's more likely to reach the nerve of the tooth faster, which we do not want. So fluoride treatments help to strengthen tooth enamel and make it more resistant to acid attacks from the foods we eat, thus preventing cavities. Because of this, fluoride treatments at the dental office give kids that extra boost in cavity prevention, tooth decay prevention, in addition to using a fluoride toothpaste at home. Now, as adults, our teeth have already fully formed, and also we hopefully have developed our own oral hygiene habits to maintain oral health. So our cavities usually do not grow or spread as fast as kids' teeth. However, there are some adults who are more prone to tooth decay than others, and for them, we will often recommend in-office fluoride treatments on an individual basis. For instance, if you are an adult and you never get cavities, you probably really don't need the extra fluoride treatment. But if you are someone who is always getting cavities, it's oftentimes a good idea to get a fluoride treatment once or twice a year as an adult, because it will help strengthen your enamel and protect against cavities. It's for preventing, it's a preventative treatment. Other reasons adults might get fluoride treatments are if they have enamel erosion, enamel decalcification, or even enamel sensitivity, tooth sensitivity. So if your teeth are sensitive and you've tried everything, you use the sensitivity toothpaste at home, you've done all the things. I'll link my sensitivity video if you want to learn more about all the things. If you've done it all and you're still struggling with sensitive teeth, then yes, in addition to preventing cavities, fluoride treatments, especially the varnish, can help you overcome tooth sensitivity. Unfortunately, most dental insurances will not cover fluoride for adults. But honestly, dental insurance barely covers anything for anybody, so I'll also link my insurance video if you want to learn more about that and other ways to get dental coverage even if you are without insurance. By the way, the average price for a fluoride treatment is around $35, so it's not a huge amount, but still, why pay for it if you don't need it, you know? Can everyone benefit from a fluoride treatment? Yay or nay for fluoride? It's a yay! It definitely can't hurt, it can only help if you get it. However, if you're an adult paying out of pocket and your teeth do not need the extra boost, say you are not cavity prone and you are not struggling with enamel erosion or tooth sensitivity, then it's usually okay to not get it. But to really decide what is best for your teeth, always talk with your individual dental provider, your dentist, and/or your dental hygienist to discuss your personal risk to benefit ratio and how important it is for you to consider it for your mouth. And lastly, before we go, I have to address the elephant in the room, because you know there will be at least one comment saying fluoride is poison or something like that. Listen, if you read the research, fluoride is a proven ingredient that prevents tooth decay by remineralizing and strengthening tooth enamel, making enamel more resistant to cavity-causing acids, thus preventing tooth decay and tooth infections. Of course, you should never overdo it, and by overdo it, I mean eat it. If you were to eat a bottle of toothpaste or drink the fluoride varnish, of course that would not be good. Just like you should never eat, say, lip balm, chapstick, right? Imagine taking a bite out of your chapstick. Ew. Lip balm is meant for your lips. Toothpaste and fluoride is meant for your teeth. Neither are meant for your stomach, especially in concentrated forms that are made for topical teeth and lips. And the amount that you might swallow when brushing or flossing is not enough to cause any harm. Same with the in-office fluoride treatments. Us dental professionals are suctioning your mouth when it's on your teeth, so you won't be swallowing it. We are suctioning it. But if for some reason you still feel uncomfortable with fluoride and you're using fluoride-free toothpaste at home, my best advice is to just make sure that your toothpaste at least has the ingredient nano-hydroxyapatite in it. If you want to learn more about natural toothpastes and nano-hydroxyapatite and which ones are best, I will link that video of mine in the description where I go deep into the fluoride versus hydroxyapatite discussion. Now we know that fluoride treatments in office can benefit anyone, but mostly kids because their teeth are still developing, and adults who are prone to getting cavities, enamel erosion, and tooth sensitivity. And of course, keeping up with your home care is key. Using a fluoride toothpaste at least twice each day. So if you're interested in creating the perfect oral care routine to prevent major dental issues such as cavities and costly dental visits such as fillings and crowns and root canals, to avoid all of that, make sure to click the link in the description or in the pinned comment below to sign up for my free oral care guide and join thousands who have already discovered all of the essentials for an effective oral care hygiene routine. This guide is an action plan for preventing and maintaining a happier and healthier smile, and I hope this video helped you. Please like and subscribe and turn on your notifications if it did. And if you want even more teeth talk, you can visit my website, teethtalkgirl.com, and hang out with me on Instagram @teethtalkgirl. Peace, love, and teeth!